In this video we will learn about why Dr. Google isn't always your friend when it comes to HIV. Why people indulge in online searches, harmful effects of online symptom searches. What to do and what not to do, how to avoid the urge to search online. Why you should not focus on HIV/AIDS symptoms online. I am Dr. Ketan Ranpariya, an HIV/AIDS specialist. Over the last 17 years, I have consulted with more than 12,000 patients. This channel is managed by expert doctors in HIV, AIDS, and the information provided here is based on scientific principles. However, it's important to remember that scientific knowledge can evolve. Much of the content here is intended for general information purposes. It is crucial to seek personalized advice from an HIV/AIDS specialist before implementing any information into your life. Our mission is to alleviate your fears and concerns related to HIV exposure, and our vision is to provide accurate and easily understandable information about HIV. Initiating post-exposure prophylaxis (PEP) medication within 3 days of exposure can prevent HIV transmission. However, after 3 days from exposure, HIV cannot be prevented by Ayurvedic, homeopathy, herbal medicine, gene therapy, allopathy, or any other form of medicine. If you're watching this, you might be feeling a lot of anxiety right now. Maybe you recently had unprotected sex, and your mind is racing. Maybe you've already turned to Google or YouTube, frantically searching for information about HIV symptoms. Believe me, I understand the impulse. When we're scared, we want answers fast. But here's the thing, while the internet can be a valuable tool for information, it can also be a dangerous trap when it comes to your health, especially when you are already feeling vulnerable. The information you find online is often misleading, incomplete, or just plain wrong. It can take you down a rabbit hole of anxiety and fear, making you feel worse instead of better. In this video, I'm going to explain why Dr. Google isn't always your friend when it comes to HIV. I'll share the real reasons why turning to the internet can actually be harmful to your mental and emotional health, and most importantly, I'll offer you healthier, more productive ways to deal with your concerns. It's a natural human instinct to seek answers in moments of fear and uncertainty. And in today's digital age, our first instinct is often to turn to the internet. But the internet, as vast and informative as it can be, is not always your friend when it comes to matters of health. In fact, it can be a minefield of misinformation, outdated facts, and fear-mongering. The problem is, the internet doesn't know you. It doesn't know your individual risk factors, your medical history, or the specific circumstances of your potential exposure. It can't offer the personalized guidance and support you truly need. Why people indulge in online searches? Well, there are a few key reasons. The need for immediate answers. We want to know what to expect, what the risks are, and what we can do. The internet promises quick answers, and in a heightened emotional state, that can seem incredibly appealing. The false promise of reassurance. We might hope that the information we find will reassure us, but the truth is, the internet rarely provides the comfort we seek. Instead, it often leads us down a rabbit hole of worst-case scenarios and conflicting information. The illusion of control. We think that by learning everything we can somehow protect ourselves or minimize the risk. But in reality, self-diagnosis is never a substitute for professional medical advice. It's important to remember that the internet is a vast and unregulated space. While it can provide valuable information from reliable sources, it's also filled with misinformation, outdated studies, and fear-mongering content. And when we're already anxious, it's easy to get sucked into the negativity and lose sight of the bigger picture. Harmful effects of online symptom searches. It's easy to get caught up in the endless cycle of online searching when you're afraid. But what you might not realize is that this habit can have a serious impact on your mental and physical well-being. Here's what can happen when you fall into the trap of obsessive online research. Increased anxiety. The internet is a vast echo chamber of information, and not all of it is accurate or helpful. You might stumble upon worst-case scenarios, outdated statistics, or misleading claims. This can easily amplify your existing anxieties and make you feel even more overwhelmed. Misinformation. Not everything you read online is true. There's a lot of misinformation and myths surrounding HIV, and believing them can lead to unnecessary panic and distress. Phobia development. If you constantly focus on the most severe symptoms and outcomes, You might develop an irrational fear of HIV, even if your actual risk is low. This can spiral into a full-blown phobia that significantly impacts your quality of life. Psychosomatic symptoms. Stress and anxiety are powerful forces. They can manifest physically, leading to symptoms like headaches, fatigue, difficulty sleeping, and even digestive problems. These symptoms can then be mistaken for signs of HIV, further fueling the cycle of fear. It's a vicious cycle. The more you worry, the more you search. The more you search, the more you worry. And all the while, your mental and physical health are suffering. So, how do we break free from this cycle of fear? How do we find reliable information and peace of mind? What to do and what not to do. So, what can you do instead of spiraling into an internet-induced panic? Let's break it down into simple do's and don'ts. Do. Seek professional advice. The most reliable way to get accurate information and personalized guidance is to talk to a HIV/AIDS specialist. They can assess your individual risk, answer your questions, and provide you with the support you need. Educate yourself from reliable sources. Stick to information from reputable health organizations like the World Health Organization, WHO, or the Centers for Disease Control and Prevention, CDC. Their websites offer up-to-date, evidence-based information about HIV transmission, testing, and prevention. Practice self-care. Taking care of your mental and physical well-being is crucial. Engage in activities that reduce stress and promote relaxation. This could include exercise, spending time in nature, practicing mindfulness or meditation, pursuing hobbies you enjoy. Don't. Avoid trying to diagnose yourself based on information you find online. Symptoms of HIV can be very general and overlap with many other conditions. Only HIV/AIDS specialist can give you an accurate diagnosis. Set limits on how much time you spend researching health information online. It's easy to get sucked in, but it rarely leads to anything productive. Don't be afraid to reach out to trusted friends, family members, or a therapist to talk about your fears and concerns. Talking about it can help you process your emotions and gain perspective. Remember, knowledge is power, but it's the right kind of knowledge, from the right sources, that will empower you to make informed decisions about your health. How to avoid the urge to search online. It's easier said than done, but breaking the cycle of obsessive online research is crucial for your peace of mind. Here are some practical strategies to help you resist the urge to Google your symptoms. Find healthy distractions. When you feel the urge to search, redirect your energy towards activities you enjoy. Immerse yourself in a hobby, spend time with loved ones, exercise, or do anything that brings you joy and takes your mind off your worries. The internet will still be there later, but for now, focus on the present moment. If your anxiety feels overwhelming, don't hesitate to seek professional help. A therapist can provide you with tools and techniques to manage your fears, challenge negative thoughts, and develop healthier coping mechanisms. Practice mindfulness and relaxation. Mindfulness and relaxation techniques can help you stay grounded in the present moment and reduce anxiety. Simple deep breathing exercises, meditation, yoga, or even spending time in nature can work wonders for calming your mind and body. Remember, you are not alone in this. Many people struggle with health anxiety and the urge to self-diagnose. But by implementing these strategies and seeking support when needed, you can break free from the cycle of fear and find peace of mind. Why you should not focus on HIV/AIDS symptoms online. It's important to understand that the information you find online about HIV symptoms can be very misleading. Many early symptoms of HIV, like fever, fatigue, or a rash, are not specific to HIV. They can be caused by a wide range of other conditions, from the common cold to allergies to simple stress. That's why trying to diagnose yourself based on what you find online is a recipe for unnecessary panic. You might start to notice every little ache or pain. The more you focus on symptoms, the more likely you are to experience them, even if there's no underlying medical cause. So, trust the experts. We, as HIV specialists, are trained to accurately assess your symptoms, conduct appropriate tests, and provide you with the right information and support. Remember, the internet is not a doctor. Don't let fear and uncertainty drive you to self-diagnose. Reach out to us. We are here to help. We understand the fear and anxiety that can arise after unprotected sex or when facing concerns about HIV. We're here to offer you a safe, judgment-free space to talk openly about your worries and get the support you need. We are here to listen to your concerns, answer your questions, and provide you with accurate, up-to-date information. We offer a full range of services, including confidential HIV testing, counseling, treatment, and preventive care like PrEP. Your health and peace of mind are our top priorities. We believe that knowledge is empowering, and we're committed to helping you make informed decisions about your health. Take the first step towards a healthier, happier you. We're here to help you overcome fear and anxiety, and get you on the path to well-being. Online consultation with HIV/AIDS specialist Dr. Ketan Ranpariya for HIV treatment, HIV counseling, laboratory test, post-exposure prophylaxis, pre-exposure prophylaxis and HIV medicine. WhatsApp message on this number.